My name is Maggie Pilasinski, and I'm a board member for Rural Healthcare Initiative. And also included with the recording, I will be sending out this PowerPoint in a PDF format to send out in case there's information you would like to read again. Just some logistics. You are muted now. If you could please stay on mute. And if you have any questions, we're going to address those at the end. I'm hoping to get about 5 minutes at the end for questions. And if you would like to write it in the chat so everyone can remember, you can certainly do that, and no, we'll address them at the end. The agenda today, we're going to go over a brief history of RHCI and the mission statement. We'll do an overview of the programs and our impacts, particularly in the last fiscal year. And then we are excited to share future opportunities and an introduction of Lisa Peterson, our new executive director. And as stated, we will have time at the end for any questions. You may recognize this familiar face. This is Alice Carpe. Alice was born in Tikonko, Sierra Leone, and trained as a midwife in Liberia. Growing up, Alice witnessed many women die due to complications from childbirth. And after a long, horrifying civil war, which lasted a decade long, Alice was eventually granted asylum to the United States, where she shared her dream to help women and children back in her hometown of Tikonko. In 2011, Rural Healthcare Initiative, also known as RHCI, was formed as a nonprofit with a mission to partner with rural communities in Sierra Leone in redeveloping healthcare systems to overcome one of the highest maternal and child mortality rates in the world. Together with supporters like you, RHCI continues its life-saving work. There are 4 key programs to RHCI, each of which we will discuss and talk about the impacts. The first is the birth waiting homes. RHCI runs and operates 2 birth waiting homes where expectant women, near-term mothers receive care with antenatal, postnatal, and newborn health care. Women receive 3 meals a day, laundry service, housekeeping, and security. They also receive transportation. This is to and from the healthcare facilities for childbirth, as well as to and from their home villages. Women receive health education on hygiene, nutrition, breastfeeding, family planning, and agriculture. They also receive skills training, such as tailoring and tie-dye, as well as social activities with the other women. And this photo on the right is a beneficiary from the birth waiting home. Her name is Hawa, and her son, Joey, who is a healthy baby boy. We were so excited to finally open the doors of our second birth waiting home in January 2021. The photograph above is right when the construction was finishing up, and this was all made possible with a collaboration of the U.S. Embassy and Friends of Sierra Leone. We had grants through them, and also in collaboration with the Gondama Community Health Center, which is conveniently located right across the street from the birth waiting home, and also the residents of Gondama. You can see in the photo below too, these are expected mothers. Actually, if you get a close look, you can see they're holding toothbrushes that they received in a shipment from Minnesota, and a video. It looks like there's dogs on there, but that's the video that is typically used, or the computer used, for educational opportunities as well. We are ecstatic to share some tremendous impact numbers that we have had at these birth waiting homes. Since January 2020 until May 2021, RHCI has had 241 pregnant and postpartum women that have stayed at Baumi in Tikonko and the Gondama birth waiting home. Since opening the doors of our first birth waiting home, Baumi in Tikonko, January of 2018, we have had 659 pregnant and postpartum women that have stayed at either the Baumi or Gondama home. And we are thrilled to share this number again. Still yet, there are 0 maternal deaths at either home. And photographed here is the Baumi birth waiting home located in Tikonko town. The second program to highlight is Rural Health Redevelopment. which includes mobile outreach clinics to 8 rural villages, providing medical training for community health workers, partnering with local health centers to provide medical supplies and medication, as well as provide transportation for patients to healthcare facilities. This photo is of mothers and children eagerly waiting to have checkups at a mobile outreach clinic in Gondama. In collaboration with the Gondama and Tikonko Community Health Center, who provide staff such as nursing staff, we have since January 2020 until May 2021 had 5,600 children's visits, typically for malaria, respiratory and skin infections, malnutrition, and vaccines. We have also had 1,120 prenatal visits. This photo here is nutritionist Umu Shower showing local women food demonstration. Included in the outreach clinics and more is our family planning consultation. This is run by RHCI's head nurse, Juliana Segba. You can see her photographed here on the right with volunteer Alexa Hofer at a mobile outreach clinic. Since January 2020 until May 2021, we have had 3,078 consultations and contraceptives supplied. Of these, contraceptives are oral contraceptives, Depo-Provera shot, implants, and condoms. In order to strengthen existing healthcare systems, in collaboration with Midwives of Missions of Service, in the fall of 2020, these beautiful women on the right, 26 traditional birth attendants from the Gondama catchment area, completed a 3.5-week training to become certified community health workers. And I would like to point out too that many of these community health workers and others that RHCI trained in collaboration with Midwives of Missions of Service are part-time employees for Rural Healthcare Initiative as well. As you may know, a major factor for the success of rural health redevelopment is transportation. Before RHCI's existence, women would often walk many miles during labor to reach the nearest health center for child delivery. Many sick children around did not have access to transportation or ambulance, and oftentimes this would result in death. That is why we are so grateful to have 2 4-wheel drive Toyota trucks and 3 motorbikes. And since January 2020 until May 2021, we have had over 530 patient transport. This includes pregnant and postpartum women and their babies and critically ill children. But there are many more trips that have been taken with these trucks and motorbikes, including outreach clinics, supply trips, transportation for staff, and many more. And finally, part of Rural Health Redevelopment Program is the donations of medical and baby supplies. We are so grateful for the many volunteers that help pack barrels and get supplies. Photographed here on the right are volunteers from the First Presbyterian Church of White Bear Lake helping pack barrels. And in the past year, $16,000 worth of supplies have been shipped from Minnesota to Tikonko. And within Sierra Leone, $29,000 worth of medical supplies have been purchased by RHCI. Before we move on to the next program, I wanted to take this time to share a special video. And I apologize, the sound is a little quiet and there's not a translation, so I may talk over the video. But this is Martha Stephen, and Martha would like to share her gratitude to RHCI, and I would like to share that with all of you. And you may hear the word Baika said a few times, and Baika means thank you. Martha is 20 years of age. She has 1 child. There's a girl who is currently alive, and she is awaiting childbirth at Gondama Birth Waiting Home. She explained during the video how important transportation is, and that how important the birth waiting home is. She said, that traveling to the nearest health clinic, especially at night and especially during the rainy season, even with a motorbike, is extremely dangerous. She talks about how important it is to be close to the health center and to receive monitoring and evaluation during her stay. For those of you who joined us last fall, we shared how we are thrilled to be furthering our focus to reach more children in need. I'm sorry, I'm going to make sure that this is a full screen. More children in need. Our Children's Health Program, in partnership with the Tikonko and Gondama Community Health Centers and staff, allows RHCI to provide healthcare and nutritional services to children. This includes evaluation and treatment for malnourished children, including supplemental feedings and caregiver education. This also includes diagnosing and treating malaria, acute respiratory infections, and other common illnesses. It helps improving access to immunizations and transportation and paying for hospital care for critically ill children. Photograph on the right here is a malnourished child that is being evaluated during the mobile outreach clinic. Now, we've addressed many of the impact numbers about child care during the Rural Health Redevelopment overview, but in particular, I want to point out this child who's photographed on the right here. And this child is being assessed for malnutrition with a MUAC, a mid-upper arm circumference. And Umu Shower, RHCI's nutritionist, was hired in May 2020 to lead the child malnutrition program. In the past 14 months, Umu has helped RHCI have 938 child malnutrition visits for over 250 children. Through this, this is all accomplished through ready-to-use therapeutic food distributed to the children, along with caregiver education. This program was identified as a high need, and we are thrilled to see the incredible impact that it's made since the start of the program. Our fourth and final program is food security. The widespread food insecurity can lead to malnutrition, poor health, and even mortality. RHCI addresses these challenges by growing food at a garden and farm located at the Tikonko Birth Waiting Home for patients and staff. We educate admitted women at the birth waiting home with hands-on education on the farm, as well as local farmers, and supporting 3 farmer-based organizations, many of whom are women. And this photo on the right is women who are actually assisting on the field with weeding, and they're getting education, hands-on education along the way. This data I'm going to share with you is from April 2020 until June 2021. Since then, we have helped over 60 local farmers from 3 farmer-based organizations, many members of whom are women. They have received agriculture education from a hired agricultural consultant. We've also incorporated having women from the birth waiting home receive this hands-on education in the garden. We are thrilled to share that 30 young men from Bow Youth Group attended educational sessions. And of these boys, or young men, are photographed on the right with volunteer Calvin Downer, who has trained local farmers, including these young men, using RHCI's land as demonstration. I wanted to highlight some of the talent that we have on the Committee for Food Security, including Steve Clark, who is an international agricultural development specialist with over 40 years of experience in designing and delivering technical services and training. Also on the committee is Bill Pilasinski, PhD, with international agricultural biotechnology consulting experience with over 40 years of this experience, receiving numerous awards and patents. I did want to point out these particular people because they have so much talent and there's so much bandwidth behind this program. I am going to send out, again, these slides in PDF, and their credentials. I do encourage you to read them, but for the sake of time, I'm going to skip over them for now. I do also want to highlight our academic partnerships. We are thrilled this past year to have worked with the University of North Carolina School of Public Health Humanitarian Project. In particular, Sheila Leatherman, who leads the UNC team as a professor of global health policy at UNC's Gill School of Public Health. Also, Leslie Little, PhD, has developed and implemented and evaluated behavior change interventions for more than 25 years. Sheila and Leslie are supported by two graduate students, Margaret Hawley and Doreen Aliuma. And Doreen has worked at a refugee camps in Africa with a focus on malnutrition. The goals of this partnership are to improve the quality of RHCI services, as well as evaluate the programs to see if they're meeting the needs of the people they serve. It is also to improve health behaviors and support RHCI's nutrition program. And these projects are of collaboration in literature research on child malnutrition, consultations and support for our child malnutrition programs, and evaluation of programs from the birth waiting homes, motorbike outreach, and stakeholders in Sierra Leone, as well as RHCI staff. Again, there's abundance of talent on this team, and we are so grateful for these volunteers, including Sheila, who her credentials, I'm going to send this out and encourage you to read through her fantastic work, as well as Leslie Little. And these faces here are RHCI staff. None of this would be possible without the hardworking in-country staff. We have 14 full-time employees who are photographed to the right here, and over 60 part-time employees who receive stipends, many of whom, as I noted before, are community health workers from remote villages. Not only does this allow RHCI to thrive, but give the opportunity for these employees to have a steady income to support their families. We're so grateful for their work. I'm actually going to hand it over to Dr. Carol Nelson, who will be explaining some of the impacts COVID has had on our programming.
Thank you, Maggie. The extent of COVID in Sierra Leone is very difficult to know for certain because of limited testing. However, we do know one major effect was the loss of Dr. Van Desambi back in 2020, early in the pandemic. He was a doctor at Bow Children's Hospital, where we referred many of our ill children to. That was a huge loss for the community and for RHCI. Around that time in May 2020, RHCI instituted COVID precautions, including masking, distancing, and increased hand washing. And then in June, because of increased concerns in 2020, we reduced the services at our motorbike outreach clinics briefly, fearing the spread of COVID. However, the Department of Health, actually it's called the Ministry of Health and Sanitation in Sierra Leone, considered our services essential and encouraged us to restart, which we did, and they've continued on. We also reduced admissions, or limited the admissions to Baumie Mother's Home for several months to reduce risk of spread. So the total numbers of women staying there in 2020 were lower than in 2019, but we're back to kind of the normal capacity now. Unfortunately, in the last month, there have been an increase of cases reported in Sierra Leone, and our staff are following this very closely. A limited amount of the vaccine has been made available, and 4 of our staff members have already gotten the first dose. We're planning to require all the staff to get the vaccine once it is fully available, while continuing with the precautionary measures in the meantime. And the government of Sierra Leone has at intervals reduced travel between districts and continues to require masking, since there's such little access to oxygen or ventilators in all of Sierra Leone, and an increase in COVID disease would be a huge threat to many Sierra Leoneans. But RHCI is leading the way with its precautionary measures and with requiring its staff to get the vaccine, plus providing transportation for others who are interested in access to the vaccine. We'll continue to monitor this closely, and we're hopeful, if things are stable, that a team from Minnesota can return to Sierra Leone in January 2020, if all goes well. And I'll turn it back to Maggie.
Thank you, Carol. I'll point out some of these photos here as well. The one on the left is with the bucket. It's actually called a veranda bucket, but it's a hand washing bucket. At the start of when COVID was identified in Sierra Leone, were distributed to community health centers and donated from RHCI. At the top right is a photo of the man in the middle is one of RHCI's tailors, and women that were admitted in the birth waiting home helped make masks and distribute masks. And the bottom right photo, I just smile every time I see it, is our in-country director, Manly Jongapi, getting his vaccination, COVID vaccination. I know that was a lot of information. We were so thrilled to share the impacts that we've had in the last year or so, but there are still so many future opportunities that we are eager to plan. And of those are 2 portable OB ultrasounds and trainings locally in Tikonko, as well as improving programs based on current program evaluations. And of these include malnutrition program and having more frequent child visits, hiring an assistant for nutritionists, and expanding malaria prevention testing and treatment. We are also doing more trainings for community health workers to assist in the malnutrition program. There will also be training and more technology for our staff, as well as leadership training for our staff. We're looking forward to having food security education reach more farmers. And finally, having a capital campaign for a facility expansion into Tikonko. We are just overjoyed to welcome our new executive director, Lisa Peterson. We are eternally grateful for Dr. Carol Nelson's 5 years of volunteering as executive director. And we welcome her to her new position as the program director, where she uses her medical expertise. And I would like to pass the mic over to Lisa as she gives a little bio about herself. But thank you, Lisa, and welcome.
Thank you, Maggie, and thank you everyone for taking time out of your evening to be part of this talk. We really, really appreciate it. You are the people, you're the, cliche, but you're the wind behind, underneath our wings. You're what makes RHCI soar, and all of these amazing things happen. And I've been saying over and over again, I'm so incredibly, genuinely, authentically impressed at the amount of mental giants and bandwidth and academic wisdom and expertise on the board and on the staff and on the stakeholders and volunteers that show up. It's really, really incredibly impressive. And I also want to thank Carol so much for having led this so well for so long and has made this transition as seamless as it possibly can be. So thank you for all that and the warm, warm welcome. I actually was assigned to Sierra Leone randomly back after I graduated college in 1988. I had no idea where I was going, and I was dropped off, you can see down there by the Liberian border. And back in the day, of course, there were no cell phones or satellite phones, so they came back and got you 2 years later. I'm very grateful. I was in a tiny village of about 10 or 12 houses. I lived in a round mud hut with white paint on the outside and a thatch roof. And I did learn at the time to speak Mende fairly well and Creole. I was the only volunteer in the area. And it began, I've told, when I came into the village had a last name of Sama, and they welcomed me into that. They told me to pick a new name. And I said Bendu, which I thought was beautiful. And I was called Bendu Sama every day for the next 2 years. I never heard Elisa once. And I loved it. I would have stayed a third year, but the Civil War was beginning to come over the border from Liberia, and the Peace Corps did not allow any extensions. Came back to the US. I was a chemist for several years. Then I had 4 kids in 6 years and stayed home for about 10, 12 years to raise the children. And then about 10 years ago, I had an opportunity. I went back in the workforce, and General Mills had just started this nonprofit called Partners in Food Solutions. And by Ken Powell, he was their CEO, and now he's chairman of the board. And he had been challenged by Kofi Annan at, I think, Davos or one of the international food conferences about what is General Mills doing to work on food insecurity all over the globe. And they came up with Partners in Food Solutions. So they partnered with Cargill and Hershey and Ard Mills and other big food companies, and they connected all those food scientists with small and growing businesses on the ground in Africa. All of you on this call can appreciate the beauty of that model. It's a transfer of technical knowledge. I absolutely loved it. We were predominantly in East Africa with the exception of Ghana and Cote d'Ivoire. I did that for 8 years, and I was the director of finance and HR, which I just loved. Then I moved over to inner city Minneapolis, and I led a nonprofit there for the last 2 years, which I also loved. We came alongside people coming out of prison and addiction services and helped them rebuild their lives and get a fresh start and a second start. And in the beginning of 2021, I merged us with a much bigger organization that was much better positioned for grant funding here forward, and that was a beautiful synergy. And then I stepped off as AD. So I was looking for my next opportunity as I'm now an empty nester. My kids are 18, 20, 22, 25, 30, and 32. And I saw this on LinkedIn, and I just, it was talking about nonprofit work in Africa, mission-driven, maternal health, grassroots, very collaborative. And then the last bullet was it was in Sierra Leone. And then that's just when I was so excited. I think I emailed Maggie and Carol and any other name I could find in that LinkedIn ad and said, I'd love to talk to you and I want to apply. And when this all worked out, I just cannot believe my extraordinary good fortune, and my family and friends can't believe it either, that we're back in Sierra Leone for real. So a chance for me to use my skills and my passions in a country I love so much, that's such a part of me, is an absolute gift. And I'm just thrilled beyond measure to be in this seat, and incredibly grateful for all of you that made RHCI so successful and so strong that it's just plowing forward into the next chapter, and I get to be part of it. So thank you.
Thank you, Lisa. We are so pleased to have you with us as the new AD. Thank you for the introduction as well. Now, I know we may have gone right at the dot of time, but I do want to be sure that we have time for any questions that anyone may have. It's a small enough group where we can unmute or raise your hand or write in the chat, but feel free to ask any questions or any comments.
One question I have is the electricity still as erratic as it used to be? Because I get stuff that Freetown and McKinney-Bow and Kenema might have electricity once in a while, but it's still very erratic. And if you don't get the rains soon, if the hydro at Pambuna might not work as well as it might ordinarily.
Carol, go ahead.
Well, I think I'll just speak for the area we serve in. And initially there was no electricity. And so we were fortunate that one of our generous donors donated to have solar panels at our Baumi Mother's Home. So we had electricity through that. Interestingly, Tikonko was somehow chosen as a town to get an electrical grid, solar electrical grid through the British government or somewhere in Great Britain. And that was installed this past year. So there was light all over town. However, it's not as much now because people are starting to have to pay for it. Initially, they gave the first month free, I believe, but there's actually some electricity by solar. So I'm sure it's not likely to be highly reliable, but there is some limited electricity in Tikonko, but there isn't in any of the other villages where we serve. And so it's a matter of there might be an occasional person with a generator. We are getting a generator installed and we have some solar lighting at the Gondama Birth Waiting Home, and have provided some solar lights for the other locations as well. But electricity, I think, is still unreliable. Alice, do you want to comment on anything you know about what's going on with electricity? Oh, can't hear you.
No, as you have rightly said, there's no electricity. We are just fortunate to even, receive the solar system that is going on now. But there's no electricity. Not even in Bo, people are complaining. They used to get it, every now and then, but it's very bad right now.
Mm.
Yeah.
Yeah.
We did provide the solar suitcase for the Tikonko Health Center and have provided actually several similar things to the Gondama and Kasama and Demahun, so they'd at least have light and access to charging phones.
Great question. Are there any other questions or comments?
And I don't know, Alice, did you want to share any thoughts? You were able to do that earlier in our first talk today over lunch. Did you want to share any parting thoughts?
Oh, you guys have said it all, and I'm sure the guests that are on board are, should be very impressed with what you guys have done. So I just want to take this time to thank everyone for coming. Our supporters are, it's because of them that we are even where we are today. So I just cannot thank them enough. Without them and the board and all the support we have, our volunteers, our board members, and everybody, the dream would not have been realized. So I just take this opportunity to always say a big bye, Imende, and thank you so much for supporting us. We have big dreams to move forward, and nothing is going to happen without your continued support. So I pray and hope that you guys will be with us for a long time. Thank
Agreed.
you so much. Yeah.
Thank you.
Thank you, Alice.
I want to thank all of you for doing this, and all of you for pitching in to help Carol and Alice and Lisa now. It's a lot of work.
Right.
Gotcha. Well, we will hang tight for anybody if anyone wants to stay on and chat, to have any questions or comments. But thank you so much, everyone, for taking the time this evening to come. Tonight or tomorrow, you will receive a recording and PDF of these slides to review if you would so choose. Otherwise, have a wonderful evening, and thank you so much for coming.
Thank you.
Bye, guys.